Hello. Thank you for your interest in our program. My name is Dave Seipert, and I am the Medical Director of our Ambulatory Medicine Clinic. I will be talking with you about your outpatient general medicine curriculum. So first off, I'd like to start with showing you some pictures of our facilities and also discuss the support we provide for both you and our patients. Pictured here is Riverside Community Medicine. This is your outpatient office. It is located right on Riverside Methodist Hospital's campus. Here is a bird's eye view of our medical campus. The medical education department is indicated by the yellow star in the middle of our map. I've also labeled our resident outpatient office towards the top right of the drawing, and this is where your outpatient ambulatory medicine experience occurs. As you can see, it is a short walk from the medical education department, and the parking lot directly adjacent to the building is where you park during your weeks with us at Community Medicine. Here are two pictures from inside our office. As you can see, Riverside Community Medicine was recently updated and our facilities are top-notch. Our main preceptor room is pictured on the left, and before COVID, our attending physicians and resident physicians would work side by side managing our patients. In the COVID era, we have spread out and utilize our nursing and medical assistant stations as pictured on the right. Here is our list of board-certified clinical faculty. Our team is made up of both general internists and subspecialty providers. So how do we support you during your ambulatory medicine rotations? Well, we have multiple full-time general internal medicine physicians who work alongside you providing patient care. We are also lucky enough to be fully staffed with registered nurses who are really the backbone of continuity of care for our patients. Finally, we have several medical assistants that room our patients, complete in-office testing, and schedule follow-up appointments. So how do we support your patients? Well, we are fortunate at Riverside Community Medicine to have multiple on-site services. As you can see, we have a pharmacy with prescription drug assistance. We have an on-site lab, so your patient can have their blood and urine testing completed before they leave the office. We have on-site financial assistance. We have an on-site social worker. And we also have an on-site scheduler, so many of your patients' appointments and tests are scheduled before they leave. We also are able to send our patients to the nearby Bing Cancer Center, which is a short walk from the office, for a lot of basic imaging. Let's transition and talk about your outpatient schedule. We follow an ambulatory care team model. We have 3 color teams as listed below. Our residents are equally divided amongst these color teams, and at any given time, 1/3 of your color team is with us in the primary care office. The rest of your team is covering the inpatient hospital wards. This separates our inpatient and outpatient curriculums and allows you to focus strictly on ambulatory medicine when you are with us in the office, and subsequently focus on your inpatient medical duties when you are assigned those rotations. Each team has an assigned nurse care coordinator, a medical assistant, and 2 attending physicians who work together to provide patient care. So here's an example of what your weekly schedule will look like. Listed below are 3 ambulatory templates, each assigned to a color team. Every 17 weeks, or each third of the year, your template will change. This ensures you have a variety of experiences and are exposed to all of our subspecialty clinics and education half days. If you look at Schedule Template 2 assigned to the yellow team, you can see that each week is made up of continuity clinics, administrative time, specialty clinics such as Hem/Onc clinic on Wednesday morning and pulmonary clinic on Thursday afternoon, and education half days such as geriatrics on Thursday morning. I'll give you a moment to look through the rest of the schedule. So after seeing an overview of your schedule, let's next discuss your continuity clinics. This is your private office hours where you provide longitudinal care to an assigned panel of patients. The ACGME mandates that at least 10 months of your internal medicine training is focused on outpatient medicine. Our program offers 4 half-day continuity clinics per week. Your patient slots are made up of new, established, and also same-day appointments. The number of appointment slots increase as you progress through training. For example, as an intern physician, you will start seeing 2 to 3 patients per half day. Our PGY3 residents are assigned 5 to 6 patients per half day. You will manage your own cohort of patients, but you will also be managing other patients on your color team who may have an acute issue or need close follow-up after their PCP appointment. Again, this team coverage model allows you to focus on outpatient medicine when you are here in the clinic and inpatient duties when you are assigned to hospital services. We are fortunate enough to be able to provide a staffing ratio of 1 attending physician for every 2 to 3 residents. This is an optimal ratio for us that allows us to provide appropriate oversight to your patient care and also gives us enough time to teach outside each patient encounter. Now let's discuss our specialty clinic assignments. This is a very important part of Riverside Community Medicine. This is how our residents provide specialty care to their underserved patients with limited specialist access. At Riverside Community Medicine, we provide hematology and oncology care, endocrinology care, rheumatology, gerontology, gastroenterology, pulmonary, allergy and immunology, and behavioral medicine care. Our office also houses specialty clinics in the following areas: a general surgery resident clinic, a dermatology resident clinic, and a hospice and palliative medicine outpatient fellowship clinic. So moving on to the education part of your ambulatory curriculum. Your education begins as soon as you get here. During your first 2 weeks with us in the outpatient office, we provide you with intern orientation. This allows you to become familiar with our staff, learn the expectations that we have for you in providing patient care, and also spend time in the outpatient EMR. The inpatient and outpatient EMR are the same, however, the interface looks very different. We also put you through outpatient examination and procedure simulations to bring you back up to speed on a lot of the common exams and procedures we perform in the office. Finally, we review some of our high-risk medications through patient safety worksheets. These include both opiates and anticoagulants. Built into your schedule is a Tuesday noon hour didactic with our staff rheumatologist, Dr. George. She has won Educator of the Year multiple times and provides an interactive and educational session focused on rheumatology for the general internist. Listed below are some of the topics she will cover. Separate from our Tuesday noon hour rheumatology didactics is our general medicine curriculum. This occurs on Thursday mornings between 8:30 and 11:30 a.m. During this time, you will have a series of 30-minute lectures separated by a 30-minute break to work on administrative tasks. The lectures are given by our general medicine faculty, our gerontologist, and our endocrinologist. As you can see, we try to use a variety of lecture formats and teaching methods outside of solely using just PowerPoint presentations. Listed on this slide are a few of the topics we have covered over the last few years. Moving on to the next part of the discussion, which is feedback and evaluations. So feedback is a very important part of your learning. So we focus on giving you both formative feedback and a summative evaluation of your rotation. Formative feedback or coaching is small bits of information from observed activities in a timely fashion. After each patient encounter, we try to give you little nuggets of information to help you improve. We also perform direct observable activities. We are lucky to have one of our rooms at the office with complete audio and visual capabilities. We can observe and record the patient encounter for you to watch after you're finished. This allows you to see what you did well and areas where you can improve. Our summative evaluations or rotation evaluations are completed in new innovations. These are based off of the time of year in training and your PGY1 level. We also provide you with 360 evaluations. These are evaluations and feedback from the entire care team, including the medical assistants and the nurse care coordinators. It is also very important for you to give us feedback. So twice a year, you will complete an anonymous evaluation of not only our faculty, but also our staff. We continue to strive for improvement, and feedback is an important part of a physician's training. We can also give you feedback directed specifically at the patient care you provide through performance audits. New this year, OhioHealth has given us the ability to review resident scorecards about the quality care you provide. This allows us to assess our practice and also drive improvement in patient care. For example, in the fall, you may sit down and see that you have a care gap in the number of patients that you have screened for breast cancer. You will come up with a plan to close this gap, and then in the spring, sit back down with your faculty member to see if your plan worked. If it doesn't work, no big deal. We go back to the drawing board and try to figure out what we can do better to make sure we are meeting a lot of our important quality metrics. Another avenue for resident feedback is through our Ambulatory Shared Governance Committee. Our Ambulatory Shared Governance Committee is chaired by Dr. Nick Mazenko. This is a multidisciplinary team made up of residents, attending physicians, medical assistants, nurse care coordinators, office administrators, social workers, and our practice manager. This is an opportunity for you to bring issues amongst the entire office and discuss how we can work together to improve our daily workflow in the patient care we provide. To the right are some current projects we are working on together. Lastly, I'd like to highlight our primary care track. So our primary care track is directed by Dr. Nick Mazenko and supported by Dr. Chris Barlow. This is in a way for our residents who are interested in primary care to focus their PGY2 and PGY3 years on outpatient general medicine and the subspecialties. This track is offered to 2 interested medicine residents per year. These residents get exposure to a private practice office in our community. This allows them to see what providing general internal medicine is like outside of a resident office. We collaborate a lot with our family medicine residency as well. They help us provide experiences in osteopathic manipulative therapy and also ultrasound-guided joint injections through their board-certified sports medicine physician. It is with these 2 physicians and their private practice groups that our primary care track residents spend time with during their PGY2 and PGY3 years. Dr. Matt Skomorowski and Dr. Bill Schnackle are both prior graduates of our program. They are fully invested in your education and enthusiastic about providing general internal medicine to our patients in Central Ohio. Here is a look at our primary care track residents currently in the program. If you get a chance to interact with any of these residents during your interview day and you are interested in primary care, please talk with them about their experience. Finally, I want to take a moment before we conclude to recognize some of our prior graduates. These individuals were all recipients of the Ambulatory Medicine Resident of the Year Award. This award is voted on by all of our faculty and staff here at Riverside Community Medicine. Why I think this slide is important is to point out that not one of these three individuals pursued a career in primary care. However, they were all engaged and provided tremendous outpatient medicine. Our residents here at Riverside are engaged in both inpatient and outpatient medicine and truly enjoy their experience in both settings. That concludes my part of the presentation. I hope you were able to gain some insight and information about the outpatient part of our curriculum. Thank you again for your interest in OhioHealth Riverside Methodist Hospital's internal medicine residency program, and I look forward to having a more in-depth conversation with each one of you during your interview day.